Hello and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communications Service, and Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communications Service, and I'm your moderator for this session and for the series. Thank you so much for joining us. We have with us again, of course, our New South Wales Health Senior Medical Advisor, Dr. Jan Fizzell, to provide key messages on COVID-19 updates, flu, and other public health issues and matters. And we have launched Multicultural Health Week this week from the 5th to 11th of September with the theme Cancer Screening Saves Lives. And so we have joining us this afternoon to speak about the key messages for Multicultural Health Week 2022 and cancer screening. We have with us the Chief Cancer Officer for New South Wales and Chief Executive Officer for Cancer Institute New South Wales, Professor Tracey O'Brien. Thanks for joining us. And also we have with us Director for the New South Wales Multicultural Health Communications Service, Lisa Woodland. And Lisa is also the Director for Priority Populations and Health Promotion at South Eastern Sydney Local Health District. Thank you so much for joining us today. We would like to begin by acknowledging the traditional owners of the land from where we are all meeting from today. We pay respect to elders past, present, and emerging. And for Dr. Jan, Lisa, and Tracey and myself, we are joining from the Camaragal people of the Eora Nation. We pay our respects to those who are also acknowledging the multicultural communities represented in this session today. Thank you very much for always keeping your microphones on mute. And as we have only 30 minutes, but maybe we'll ask if our guests can join us for another extra minutes if you have any questions. But please keep your microphones on mute, ask your questions on the chat, and we'll make sure that we can answer them for you this afternoon. But if not, you can send us emails. And we'll also be sharing some links to the resources for Multicultural Health Week and COVID-19 on the chat. So please keep your questions and your comments online, and we'll want to have a lively discussion today. So now I'll pass it over to Dr. Jan to give us some COVID-19 updates and on other flu and public health matters. Hi, Dr. Jan.
Hi, Jess. So we had 3,666 positive test results for COVID-19 returned to 4 p.m. yesterday. We had sadly 21 deaths to report, 11 men and 10 women, and we send our condolences to all those impacted by COVID. It's still definitely with us. We had 1,581 people in hospital, including 37 in intensive care and 13 who are on ventilators and 1 who's on extracorporeal membrane oxygenation. We've got some good news with our vaccinations. They're still available, and it's still very important that people stay up to date with their vaccines. At the moment, of people aged 65 and over, 67.1% have had 4 doses of their COVID vaccine. So there's still a number of people who could do with that extra bit of protection. So please do keep encouraging people to stay up to date with their COVID immunisations.
Thank you so much, Dr. Jan, for that update. As we said, it's Multicultural Health Week, and it's one of the most important weeks in the health calendar. Lisa, how important are the key messages for Multicultural Health Week and for us to know about this week and the messages that it provides?
Well, Multicultural Health Week is a really fabulous opportunity for us to raise awareness around the health issues that impact on culturally and linguistically diverse communities, and also how we can, as a health system, can address these. And I'm really proud to say that we're now in our 13th year of Multicultural Health Week. And the theme this year is Cancer Screening Saves Lives. And we know that this is a critical message to all our culturally and linguistically diverse communities.
As you said, the theme is Cancer Screening Saves Lives. And cancer screening, we're promoting for this week the 3 national cancer screening programs. Professor Tracey O'Brien, thank you for joining us. How important are these programs being promoted to multicultural communities?
Thank you very much, Jess. As Lisa said, the theme this year is Cancer Screening Saves Lives. And we have 3 terrific world-leading cancer screening population-based tests in Australia. They're for breast cancer, bowel cancer, and cervical cancer. These are simple tests that help detect cancer at its earliest stage of development, often before there are any signs or symptoms that you may feel in your body. And this is when treatment is usually at its optimal, so your chance of survival is the greatest. Now, we do know that people from linguistically diverse, culturally diverse communities are less likely to participate in our cancer screening programs. There are lots of reasons for this, and we'd really like to send a message out this week to encourage people to participate if they're eligible for these cancer screening programs.
Thank you, Tracey. Dr. Jan, during COVID, of course, a lot of people were not going for testing. They were more concerned about COVID. How was that? And you've been going to communities and trying to promote, making sure they go to their GPs.
Yeah, and I think that's one of the things that a number of our screening services were disrupted when COVID was happening. And so people who might have come due for certain appointments may have missed those appointments. So it's a really good idea to have a look back in your old diary, have a look and see if you've had a letter more recently to say it's time to book in and get your screening done. Those invitation letters do come out, but another way you can do it is to talk to your GP and just see, when did I last have a cervical test? When should I start screening? And that connection back with our family doctors can really help us reestablish that, that trust and that ability to keep moving forward, looking after our own health during COVID. And now as we start to emerge from COVID, making sure that those important health checks are back on our agenda.
Thank you, Dr. Jan. And also there are, as you mentioned, Tracey, there are barriers within multicultural communities. Can you outline some of those?
There are a lot of different barriers for people from culturally diverse, linguistically diverse communities in terms of accessing screening. These can include things like just simply a lack of awareness. These screening programs may not have been available in a person's home country, for example. There's clearly some language barriers, and we're doing a lot of work around that area to produce in-language material around cancer screening. There's also, in many communities, there's shame, there's fear, there's stigma, and there's blame around cancer. And we're trying to break down some of these barriers to help it for communities to feel safer and encourage them to access the cancer screening that it's available, because there's no doubt that these screening tests save lives.
Thank you, Tracey. And Lisa, you're talking about barriers and languages. And Lisa, there have been resources developed for multicultural health within cancer screening. And what are these resources?
Well, this year we've been able to develop a whole suite of resources in partnership with the Cancer Institute and also in partnership with the media. So we have a range of radio ads, social media tiles, postcards, posters. We have a video, and we also have a combined cancer screening fact sheet. And this is a really important resource because this is the first time that we've been able to bring together information for communities around these 3 screening programs and to provide that in 38 languages. This is really important because we know when we provide information to one person within a family, they then become a really strong advocate and share that information with their family, their extended family, and their community networks. So it's up to everybody to know about all the 3 screening programs. And I really encourage people to share that information through those networks that they have.
Thank you, Lisa. And I'll go to Dr. Jan about how, there's always these new things that you are presenting a lot of information sessions to communities with new information, like new tests, like Tracey said, there are new information. How are you able to express that? And how do we start these conversations with our families, with communities, ensuring that they get informed?
Look, and I think one of the things that we really learnt through COVID was the power of community and the power of family as a network together to help navigate the healthcare system. So we had people who were younger, who were more digitally literate, making appointments for people for COVID vaccinations. So if those same young people can help their older people in their family, so it could be their older sister who's 25 or over for the cervical screening, it could be their mum or their grandma for the breast cancer and bowel cancer screening, it could be their dad and their uncle for the bowel cancer screening. If when a member of your family comes to you and is having any trouble, if you can help them navigate our system, that's a really useful thing. And just spread the word that, no, this is what we do here in Australia, that there's a really good way of helping prevent cancers, and that we do talk about cancer here in Australia because it's something that when we find it early, we can do so much for. And I think that's a really big difference. When we find these cancers early, we can do, and it's even before some of the lesions become actually cancers, we can actually stop it even before it becomes a cancer if we get these screening programs working.
Early prevention saves lives, right?
That's right.
Tracey, there are new details and programs that are important for the communities to know. There's self-collection now for cervical screening.
Yes.
There's that kit for bowel screening when you turn 50. Can you please explain more about that?
So the cervical screening changes, I think, have been a game changer. From July 1 this year, women are able to do a self-collection at their health provider and have that opportunity to have the privacy and privacy around the collection. And for a lot of women, this is a very important thing. So that's been a great breakthrough. You can ask your health provider about that. Bowel screening starts in Australia from 50 through to 74 years of age. It's a free screening test. It's sent out in the mail. If you haven't received the test, you can jump online and do the test and request a test to be sent, or you can speak to your local doctor as well. A lot of people receive the test, they intend to do it, and they put it in the drawer, and it won't diagnose cancer in the drawer. So we encourage people to use the test. There are online at the Cancer Institute website, which is www.cancer.newsouthwales.gov.au. There are in-language videos that show how to use these tests. They're simple. You do them in the privacy of your own home for bowel cancer. And early bowel cancer has survival rates up over 90%. So certainly not a death sentence, something that we encourage people to be proactive in protecting and demonstrating a healthy lifestyle by doing these free tests.
Thank you, Tracey. And I guess we know that there's information available and new resources, but community is important in delivering these messages. Lisa, there is a community grants program for Multicultural Health Week, and where organizations have been provided some funding.
I think that's a really important point, Jess, that information by itself isn't enough. We really need to make sure that we're engaging with communities and spreading the word within communities. So this year for Multicultural Health Week, we've been able to provide very small community grants to a large number of community organisations. And this is for them to organise some community engagement activities and to share the information in language around cancer screening. And we've been able to support them with bilingual health professionals, bilingual community educators, and translated evaluation forms, so that we can get feedback around, from the groups about how useful they've found this information. And what we know from the research is that it's so important for people to, in communities, to hear from others within their same community about the importance of these, of health information. And we know that community leaders and peers are very, very effective in encouraging people to participate in cancer screening programs. So we're really proud to be able to offer those community grants, and that sits alongside a number of other community grants that I know that the Cancer Institute have been sort of generously providing for many years as well, to really reach deeply into communities with this important information.
Thank you so much, Lisa. Just talking about the resources that's available, but then there's these conversations of anxiety, of knowing about cancer if they have it and diagnosis. That is one of the important things that people are concerned about. And in some communities, they don't talk about cancer at all. Tracey, want to talk about this?
I think there's a lot of fear around cancer. I think there's a misconception that cancer is a death sentence. And of course, now cancer has a survival rate of over 70% for all people who are diagnosed with cancer. There is stigma, Jess, there is around the test itself, there's blame and there's even shame in some communities and some cultures. And I think that's where, as Lisa has touched on, using communities to talk to each other, to break down some of these barriers, having community leaders take a role, having in-language material to explain that these tests are simple, that they result in saving lives, that they have benefit. We encourage everybody to do the test for themselves, do it for their families, do it for their communities, because dying from cancer is also a horrible thing that people want to avoid and want to do for their families. And doing a screening test is a simple way to have the best outcomes.
Thank you, Tracey. And if you have any questions, please add them onto the chat. And as you've seen, there are some resources and links to information that you can use in multiple languages. Dr. Jan, what is the role of GPs in delivering these messages to communities?
Look, I think it's really important because we know that for a lot of communities, their most trusted resource in healthcare is their GP, and particularly a GP who's of a similar cultural background to themselves. And I think that's where we're really encouraging GPs. We know that GPs at the moment are time poor. They're having a lot of stress because of all the work that's come their way, particularly with COVID. But just to take that time to have that conversation, just a gentle reminder, because we also know that when a health professional suggests a health intervention, people are more likely to take it up. So as community leaders, the GPs have been incredibly generous with the amount of time that they've been giving to the community right through COVID. And now as we emerge, this is one of those things that they can promote to their community as something to keep people well now that, whilst we're doing all the other work that we've been doing.
Thank you, Dr. Jan. And Lisa, in your role in priority populations, with communities, what is the best step in trying to reach the grassroots level?
I think, just picking up on what Tracey was saying about stigma and shame, I think it's really important that we have these community conversations, because that's the way that we can break down stigma and shame. And I think everybody has a role in that, from GPs, from young people in families, but from older people in families as well. It's the sharing of stories, the sharing of experiences that really makes a difference. And we often hear stories about people who have experienced cancer. We also want to hear stories about people who have gone for a screening test and it's been fine, because that's a really important story to share as well. So I think that if we can encourage people to share those stories, that does make a big difference. And just to add to that, and what Jan was saying, I think, particularly the role of GPs who speak the same language as somebody is so critical. And I'm really so pleased that the self-collection is available for women, for all women. But I know for a lot of women from culturally and linguistically diverse backgrounds, they do have male GPs. It may be a little bit uncomfortable for that male GP to start the conversation, or for the woman to start the conversation. But I think it's a whole different conversation now that self-collection is available. So I'm really hopeful that that new intervention, if you like, that's become available to everybody, really increases the participation rates of women in that program.
Thank you, Lisa. Data is important. Gathering evidence and knowing who is participating and who is not, and what kind of work we need to continue to do for communities, isn't it, Tracey?
That's correct. And we do collect all of the data for those that participate in screening programs. And we do know that multicultural communities don't participate across the board in the bowel, breast and cervical screening programs as much as other community members. We continue to track those numbers, and we continue through the grants programs, through working with communities, through information sessions like this to encourage participation and to track that participation so that these tests are available for everyone. And it's not just making the tests available, I think, Jess, it's the importance of making sure that it's also done in a culturally appropriate and safe way. Breast screening, for example, can be booked. You don't actually need a GP if you can't get into one or you don't have one. You can book it directly yourself. It's a 20-minute test. And it's done by female-only screeners, so it's safe from that point of view if that's something that a woman feels uncomfortable with in terms of breast screening. So we certainly try and make these tests as private, as culturally safe and sensitive as possible.
Thank you, Tracey. We have a question from Tammy Yam, and she says that thanks for the cancer screening information for multicultural communities. And can we book interpreters during a breast screen appointment? And is it free? Absolutely. And you just mentioned that.
Yeah, absolutely. So the breast screening can be booked 13, 20, 50. As I said, no doctor referral actually is needed for that. But I agree with Jan, talking with your GP is always a great idea. And for translation and interpreting services, that number is 13, 14, 50, and that service can be used for booking appointments, but it can also be used to help explain some of these tests as well in language if that's what somebody is looking for. And that's a free service as well.
Yeah. Thank you, Tracey. And please keep those questions coming. Dr. Jan, with everything that's happening, COVID, monkeypox, there's Legionnaire's disease, there's meningococcal, also gastro, we've talked about all this in these sessions, and we will continue to talk about health. What has COVID done in terms of for the community and how the awareness has been different?
Look, I think possibly one of the things that a lot of people in the community didn't think about was their own health. We thought about work, we thought about our kids and what's happening at school with them, and thinking about taking time to really focus on our health has not necessarily been people's top priority. And I think we've had a lot more conversations about staying well, and in the context of COVID, about the need to look after each other, including our own mental health and the mental health of the people around us. And I think this is something that now that we've got this focus where can I get the vaccine? That pressure's come off us. It's really easy to get vaccinated against COVID now. It's easy to get treatment for COVID now if you're in a higher risk group. So we can put some of that energy perhaps that we've used for worrying about COVID to looking at how can we look after ourselves. And so it could be about increasing our physical activity. It can be about making sure that we're up to date with our screening. It can be up to date with our other immunisations. It can be getting ready to travel and see family again. So making sure that we've got our immunisations up to date for our travelling. And that can be things like, gastrointestinal illnesses as well as COVID. It's not just respiratory illnesses when we travel. And again, starting to think about if we've got diabetes, when did we last have our diabetes checked and managed? If we've got other things in our family that we need to be paying attention to, we might have thalassemia in our family, may have other things that maybe we haven't paid as much attention to because we've been trying to get through homeschooling, working from home, all trouble getting GP appointments because the GPs, as I say, have been very busy. I think it's that time to start to reconnect with our health, reconnect with those things that we can do to help prevent it. And this, emphasis on screening is such an important one because, as I say, in a lot of places, screening's not available. Here in Australia, it's available, it's encouraged, and it's such a almost mundane activity. It's something that my mum did. My mum talked about her experiences with breast screening, for example. It's something I've been doing since I was a young woman with cervical cancer screening, just because it was something that I've grown up with. But if you haven't grown up with that, that could be a new habit to get into and a new conversation to have in your family. And I think it is important that people talk to family and friends. What was your experience? And some people, you know, may have had a not great experience with screening, but again, acknowledging that it's not always 100% positive, but at the same time, it's still an important thing to do. A bit like with the COVID vaccines, you know, sometimes we ran a temperature and didn't feel that great, but gee whiz, better than winding up in intensive care with COVID. Same with cancer screening. Some people, but we're improving all the time. So the you know, the uncomfortable pap smears of old days were, you know, now we can self-collect. Things are improving all the time. And I think that improvement is also something, and our services are improving all the time. So I think that's the really important thing, is that an experience from 20 years ago may not be the experience of today as well.
Thank you, Dr. Jan. And you touched on that about knowing about it by living in Australia, but people who have just arrived recently, information is not so easy to gather and to get. And Lisa, what is that, the role of intergenerational information as well?
So I think that it is really important that people have access to information. And as I said before, that needs to be in the context of a relationship, in the context of a conversation. And what we do know is that we have some amazing, passionate advocates in the community around these screening programs. And if we can support them with information that they can take to social gatherings, informal gatherings, and share that, that's essential. And we know, you know, as Jan said, you know, young people are really critical to supporting older people in relation to accessing screening programs and feeling the confidence to do that. It's not just about information, it's about the confidence to do that. But we also know, particularly around things like cervical screening and breast screening, that older women, it's really important for them to be encouraging, you know, the younger women in their families to be part of it. And I think one of the interesting things that, you know, that I've found out about is that a lot of women who have attended community information sessions here in Australia have shared that information with their relatives overseas, and lots of our resources get shared overseas as well. So I'm really proud of that. And then through those conversations, they may have found out that their aunt or their grandmother or somebody that they know had cancer, but because of that shame, it was never discussed. And so the awareness about the importance of screening has only really just become new information to them. So I think it's just really important, as I said before, that we have these community conversations, because that's the way that we get the message far and wide to communities and really support them to come forward for screening.
Thank you, Lisa. And that's really important in terms of knowing about where to go and where to share that information. But also, Tracey, there has been bilingual community educators saying that when they talk to communities, the kits, for example, for bowel screening are left in the drawers and thrown away.
Yes. Well, look, I think that happens in all communities, not just multicultural communities. But yes, there's one thing to receive a test, there's another thing to do it. So it's that sort of being proactive rather than reactive. I think there's a few myths as well that can be broken down. Things like, you know, you don't need to do breast screening if you haven't had a family relative that's been diagnosed. Well, we know that that's not true. Doesn't matter what community you come from. 9 out of 10 women who get breast cancer, there is no family history. The greatest risk for breast cancer is age and being a woman. So the screening program is for 50 to 74-year-old women. So everybody within family should do it. Another myth, for example, is in cervical screening. If you're older and not sexually active, or you've only had one partner, then you don't need to have cervical screening. That's not true either. If you're 25 to 74 and you've been sexually active even with the same sex partner and one partner, then you should have cervical screening. So there's a few general myths that are both in multicultural communities and in all communities that I think we can share information around. And then there's specific sort of stigmas and myths within multicultural communities that create that other layer of barrier, an extra layer of a barrier, as Lisa was talking about, where cancer's not talked about within families. So that sort of doesn't encourage, and you don't share that information or share your experience of having screening. So they're the things I think we can share amongst communities. And I'd just like to echo what Lisa was saying in terms of the work that's been done in the Cancer Institute. We are working with, you know, a terrific number of ethno-specific community groups who are passionate and wonderful advocates in their own community groups in terms of spreading health messages. And it really is such an incredibly powerful thing to hear from somebody within your community that they've had a test done, this is how they got it done, it was a positive experience, and they feel better because the screening test was negative, and they've had that assurance that they've done everything they can to stay healthy and well, and being proactive in looking after themselves.
Thank you, Tracey. We'd like to show this video. We had a question, can I book a breast screen appointment for my mom? She doesn't speak English fluently. We'll come to that question in a bit, but we want to show this video that was produced by the New South Wales Multicultural Health Communication Service together with Cancer Institute in partnership with SBS. There's this video that showcases the 3 screening programs. Let's watch it.
Did you know cancer screening is an important part of looking after your health? We all know it's good to eat well, exercise every day and get plenty of sleep. For Multicultural Health Week this year, we want you to know that screening for cancer is also important. People in New South Wales are eligible for free cancer screening tests that could save your life. It's one of the best ways to find cancer early, even before you have symptoms. There are 3 tests: cervical, breast and bowel cancer screening. The tests are easy to do and could save your life. Now is the time to talk to your GP and make sure you are up to date with your health checks. It will help you to stay well so you can keep enjoying what you love to do with family and friends. Finding cancer early could save your life. For more information, speak with your GP or visit cancer.nsw.gov.au.
English, Arabic, Mandarin, Cantonese, Vietnamese, and Korean, and can be downloaded on those 2 websites. That question about can you book your appointment for your mom if she doesn't speak English fluently?
Yeah, absolutely. You can either book it on her behalf, or you could make use of one of the translation services that we talked about. So the breast screening number again is 13 20 50. You can do it online too, breastscreen.newsouthwales or nsw.gov.au, and that translator and interpreter service is 13 14 50, and that's also a free service. There's also, with breast screening, you can actually book in a community group together, so you could all go as a family if you're in the eligible age range of 50 to 74. So mum could attend with the sisters or other members of the community if that made her feel safer and more secure.
Thank you, Tracey. We had a comment from Tango, and he said that was a great video and really clear. So thank you for that comment. We appreciate that. We also wanted to just say that we're running out of time, but I guess I'd just like to go to Dr. Jan in terms of from the New South Wales health perspective, what can we, encourage the community to do, and especially the multicultural media online to remember for Multicultural Health Week and for health messages like these?
Look, I think we've worked really, really hard to be better over the last couple of years. It's been a really hard slog for a lot of people, and Jess and the team here have just done an amazing job working so hard to try and get the right messages to the right people in the right place at the right time. And we can't do it without the community. And I think that strength of the community in helping each other look after each other and taking the health messages through. And one of the key ones that we've identified is about cancer screening. We can really see the numbers have declined. We had a number of barriers over the last couple of years. And so we really want people to get back into these screening programs. And so you can help us capitalise on the work that you've done, that we've done, to help people stay healthy as we, move away from talking about COVID all the time. It's important that we have these other conversations about health. And cancer screening is one of the most amazing programs that we have in Australia. We've got such, amazing quality controls around how we do cancer screening. We don't just send people off for a test. There's a whole pathway that people follow up. So you're not just abandoned after having that test done. It's so important that people understand the amount of effort that people have been putting into making this program so strong and so safe for the community. And now if the community can spread the word about taking up these opportunities to help save their lives, it's an incredibly good story. It's a great news story, and it's an incredible thing that we can do for each other by looking after each other. Getting that screening test may mean that instead of having to have big surgery in 5 years' time, I have a tiny thing done now, and it's a huge difference to people. So by spreading that word, talking about the fact that, these tests really do make a difference, it's a huge thing the community can do.
Thank you so much, Dr. Jan. And Lisa, we talked about language. We've talked about there's resources in 38 languages, and thinking of doing more. Health literacy is key in developing these resources, isn't it? And testing.
So when we develop these resources, we take great care in the way that we do it. We often co-design the health messages with community so that they're part of that process, so that the information is easily accessible to them, that it's not only accurate, but it's really easy to understand and culturally appropriate. So it's really important, that process of not just giving the information, but making sure that the information is well received and understood within communities. And just to add to what Jan was saying, I think that the other thing that COVID has taught us is that life is really precious, and family and friends are really precious as well. So this is a really big opportunity for everybody to share that message so that we can continue to enjoy being with our families, being with our friends, being with our community, that cancer screening saves lives.
Very much, Lisa, and thank you for joining us here. And one last question, Tracey, New South Wales released the 5th New South Wales Cancer Plan, which is a great achievement. What are the things we will be expecting in the future for cancer screening?
Well, the cancer plan, as you said, was released this year, earlier this year, and I think it's a very exciting plan. And one of the main goals of the plan is to improve cancer outcomes for all people in New South Wales. So it has a really strong emphasis on equity of access to treatment and equity of outcomes. So the priority populations that we're focusing on are multicultural communities, where we know access to screening is not as good, and therefore cancer can be diagnosed later and outcomes not as well. But also we've got to focus on improving outcomes for other groups. Aboriginal Australians in New South Wales have worse outcomes, so trying to improve access to treatment there, and other groups within our community where outcomes aren't as good. So that's a really exciting thing. The screening programs really are simple, safe tests to do. Early detection of cancer is critical to saving lives. So our message from the Cancer Institute is to do these tests, to make use of them, make use of the in-language materials, speak to your GP, the community groups that are helping to push this message, because cancer screening can save lives.
Thank you so much, Tracey. And thank you so much for staying on. I know we've run out of time, but Dr. Jan, as always, thank you for joining us. And Lisa and Tracey, thank you for being with us and for all your work in delivering these messages to multicultural communities. Thank you so much for joining us online. The recording of this session will be available on the New South Wales Multicultural Health Communication Service website. We'll also send these, the recording and the resources to you on your email. Please let us know if there are other health topics that you'd like us to cover on these multicultural media online sessions. Meantime, stay safe. Happy Multicultural Health Week, and we'll see you again next time.